The Trump administration has now taken a very troubling move. All COVID-19 data collected from hospitals and other institutions will now not be sent to the CDC, and in fact, they will be sent almost directly to the White House, where they will make the decision of what information becomes public or not, and decides what information even gets passed on to the CDC. This decision by the Trump administration has many people, rightly, very nervous. CDC officials and health professionals are concerned that vital data will be censoring the virus's impact on American society. This censorship and information control will be serving the political interests of the Trump White House and not the health of the American public. The demand was very quietly made on the Department of Health and Human Services website. The HHS department, not the CDC, will now be collecting the daily reports on patients being treated at hospitals, numbers of available beds and ventilators, and miscellaneous data that needs to be tracked in order to understand the pandemic. Officials are claiming that this attempt by the Trump administration to control information will actually streamline the data collection process, making it easier for the government to allocate limited resources such as personal protective equipment and ventilators. However, many people remain ill-convinced that this is not only the goal, but this will be the effect of the data collection. The COVID-19 data will not be made publicly available, a move that will severely hinder researchers who do important work publicly. One of those affected is Jen Cates, the Director of Global Health and HIV Policy with the nonpartisan Kaiser Family Foundation. Historically, the CDC has been the place where public health data has been sent, and this raises questions about not just access for researchers, but access for reporters, access for the public to try to better understand what is happening with the outbreak. The incompetent handling of COVID-19 has been a large criticism of the Trump administration. Latest data shows that the U.S. is currently the worst place in the world for the spread of the virus and deaths from it. The Trump administration's policies in the eyes of many are nothing less than murder. The Trump administration control of COVID-19 data has many people worried, very obviously, because it is most likely that this information will be censored for the political gains of the Trump White House. Very necessary medical information may not be passed on to health professionals who are on the front lines, and many of the researchers who are also on the front lines of trying to deal with this outbreak. This development should be very frightening to anyone who wants to live in an open and free society, not just people who want to live in one where medicine and science are taken quite seriously. As it is, the United States is one of the worst places in the world for COVID-19, if not the worst place in the world. With policies like this, it seems like things will be becoming much worse for the people of the U.S. Reporting from Niagara Falls, Jason Unruhe, MRN.
Thank you for watching. If you like this program, then please head over to my Patreon page and set up a monthly donation. It's your donations that keep this program running. Also, if you would like, please rate, comment, subscribe, and share in various social media.